Democrats are raising concerns about the proposed cuts to Medicaid outlined in President Trump's budget bill.
Look at these numbers. And, you know, these hospitals are all across the board, but certain states, red states, are particularly affected. Look at this. Kentucky, more than any other state.
Today, they shared a list of rural hospitals considered at risk of closing due to the proposed cuts. 35 Kentucky hospitals are on the list.
WKYT's Samantha Valentino is breaking down how those cuts could impact you in our top story at 6.
The cuts are devastating.
Supporters of President Trump's One Big Beautiful Bill Act say it targets excesses and abuses within the Medicaid program. In a statement, Congressman Andy Barr wrote, quote, "These common sense changes to Medicaid refocus the program on what it should be there for, to be a safety net for Americans in need." The Congressional Budget Office says the changes would save more than $800 billion in federal spending over the next decade. But Governor Andy Beshear says the cuts would cost Americans and Kentuckians their lives.
Healthcare is a basic human right. And the part of health care that they would cover the people we love the most, our parents and our kids.
Governor Beshear noted Medicaid covers 50% of Kentucky's kids and 70% of seniors' long-term care costs. Thursday, Senate Democrats outlined the potential impacts of the cuts in President Trump's budget bill. In a letter to the president, they listed 338 rural hospitals they say are at risk of closing if the proposed cuts happen. Kentucky had more hospitals on the list than any other state, with 35.
It'd be devastating to what is a strong rural hospital system.
Among them are 6 Appalachian Regional Healthcare locations, 2 St. Joseph hospitals, and 2 Baptist Health locations.
Whether you have Medicaid or private coverage, you got to drive several hours just to see the same doctor who had to move to a big city, even though they loved living in your town and spending those dollars that they make in your town.
Governor Beshear also raised concerns about the jobs that would be lost if 35 hospitals were forced to close their doors.
Rural hospitals are typically the second largest employer in the county that they're located in after the public school system. Now think about all those jobs being wiped out.
In a statement, Congressman Hal Rogers wrote, quote, "Claims that Congress is slashing Medicaid and jeopardizing our rural hospitals are blatant lies." He went on to say, quote, "The bill will wholly protect the future of Medicaid by removing waste, fraud, and abuse." In Frankfort, Samantha Valentino, WKYT.
Well, the hospitals were identified as at risk based on 2 financial criteria. That's if the hospital is in the top 10% of Medicaid payer mix of rural hospitals across the country, or if the hospital has experienced 3 consecutive years of negative total margin. In a statement from the Kentucky Hospital Association, they say they endorse the Big Beautiful Bill, which they say protects Kentucky's Medicaid program. The association is encouraging the U.S. Senate to support that bill as well.